Hello everyone! Today I'm delighted to present to you the first part of our ESP Capstone project supervised by Mr. Utam Zabat and presented by Bousa Hasiba Shayib Nasima Dahur Ahlam and myself, Iman Larjan. The objectives of this presentation are defining medical English, exploring discourse analysis and linguistic features of medical English, analyzing texts and genre, suggesting activities, tasks, and texts needed by students, and finally, investigating teaching models. But before dealing with all of these, we need to look at the reason we have chosen medical English. As English has become the dominant language in global communication, its significance in medicine cannot be overstated. In this context, English is the lingua franca of medical research, clinical guidelines, and daily practice, making proficiency in medical English a necessity for all healthcare professionals around the world. This presentation will analyze how medical English differs from general English as stated in the objectives. However, it will also explore key features, discuss how these insights will later contribute to developing a targeted ESP syllabus for medical students, which is the second part of our Capstone project. So what is medical English? Medical English is not just the language used by doctors, as everyone would define it now, but it's a specialized variety of English defined by specific vocabulary and unique forms of writing. As Kane mentions here, it includes technical terms and structures that ensure precise and clear communication in complex medical scenarios. Bahatia further highlights that medical English is a genre in itself designed to convey specific functions and maintain clarity, even when dealing with very complex medical concepts. To understand medical English better, we need to explore its key features and how it stands out from everyday English. Let's look at the unique aspects of medical discourse. First of all medical language is designed to communicate complex concepts with accuracy, avoiding ambiguity. This allows doctors to describe conditions precisely and make sure their communication is clear to both professionals and patients. Abbreviations and acronyms are common in medical English. They are used to save time and enhance communication among professionals. However, these can be challenging for non-medical audiences to understand. Medical English follows standardized formats such as IMRAD framework for research papers and SOAP notes for patient documentation. These formats help ensure clarity and consistency in communication. Medical communication is highly objective. It avoids personal opinions or assumptions and relies on evidence-based practices and factual data. At the same time, it is formal, reflecting the professionalism and seriousness of the field. Casual or conversational language is avoided. The medical field often emphasizes teamwork and shared responsibility. Doctors and other healthcare professionals use inclusive terms such as our team or we suggest to foster collaboration. This reflects the collective nature of medical practice and encourages open communication between professionals. Medical English also relies on the effective use of visual data such as charts, graphs, and tables to present complex information clearly. These visuals help in explaining diagnosis, treatment plans, and research findings, allowing for clear communication between professionals and with patients. Despite the formal and objective nature of medical communication, doctors must often show empathy and care. Phrases like, "I understand how you feel" or "we will take good care of you" are crucial in building trust and improving the doctor-patient relationship. Showing empathy promotes better patient cooperation and support healing. Now that we've discussed the unique features of medical English, let's take a closer look at its vocabulary and grammar. These elements play a crucial role in ensuring that medical communication is both clear and precise. Medical English relies heavily on specialized vocabulary, which includes Greek and Latin origins. Many medical terms have roots in Greek and Latin, which helps to standardize medical language across different languages and cultures. procedures. Highly technical words, medical English relies a lot on discipline-specific words, which are crucial for clear communication within the medical community. General words with specific meanings, these are common words, for example, bandage, but they take more precise meanings in the medical context, allowing healthcare professionals to convey specific instructions. In terms of grammar now, impersonal language is commonly used in medical writing. This means that statements are structured in a way that avoids focusing on the individual and instead emphasizes the process or the condition. The use of the passive voice, nominalization, and the present simple tense are prevalent in medical texts as they help to focus on the actions, procedures, or results rather than the person involved. Additionally, the conditional is used in medical English to express possibilities, recommendations, and hypothetical situations. Understanding the vocabulary and grammar is essential, but it's equally important to recognizing the variety of texts and genres where medical English is used. Let's now explore these different types of communications in the medical field. Medical English is used in a variety of texts and genres to serve different communication purposes. These include research publications. Peer-reviewed articles are fundamental to advancing medical knowledge and practice. Clinical guidelines. These documents provide evidence-based recommendations for patient care and help standardize practice across the medical field. Patient educational tools or patient education tools, simplified explanations and instructions ensure that patients understand their conditions and treatment options. Regulatory documents, papers from health authorities and professional associations establish the ethical and legal standards that govern the medical practice. Together, these texts create a framework for ongoing medical knowledge development and the improvement of patient care. Having seen the various contexts in which medical English is used, it's clear that real-world tasks and activities are crucial for students to master this specialized language. Now let's explore some practical classroom activities designed to help medical students develop their English proficiency. Role-playing scenarios, practicing doctor-patient interactions, for example, vocabulary games, reinforcing key medical terms and working a lot on collocations, writing assignments, focusing on medical report writing or case studies, and finally, group discussions, analyzing clinical cases to improve language use in decision making. These are just examples of activities that help students bridge the gap between medical theory and real life practice. As students here practice the vocabulary and grammar used in actual medical scenarios. These classroom activities tie into a broader teaching strategy. Let's now look at some effective teaching models. Task-based learning. These are practical tasks like writing case reports or conducting patient interview. They help students practice English in real medical contexts. Content-based instruction. This approach integrates medical content with language learning, allowing students to acquire both language and medical knowledge simultaneously. Genre-based approach, students here learn the specific structures and styles of medical writing, such as writing research abstracts or medical discharge summaries. Skills-based approach, it focuses on developing specific language skills like listening, speaking, reading, and writing within the medical domain. And finally, problem-based learning, students analyze clinical cases and solve medical problems, which encourages both critical thinking and language skills. Putting this into practice, a sample lesson starts with a warmer to put students in the context and introduce key vocabulary. It's followed by listening for the different skills, listening skills. For example, listening for gist, for details, for specific information, according to the lesson aim. A post-listening task will be a role play. So students will role play the listening conversations as in doctor-patient communication. And obviously, Lastly, there will be feedback on what went well and what needs to be improved, not only at the level of language, but also at the level of discourse. While teaching models provide the structure for effective learning, textbooks play a crucial role in equipping students with necessary knowledge and skills. Let's now look at some key textbooks that are designed specifically to help medical students master medical English. As we said, textbooks play a significant role in learning medical English by combining language skills and medical knowledge. Examples of key textbooks are English for Medicine, Professional English in Use, Oxford English for Careers, Medicine, and Cambridge English for Nursing. These are more vocabulary and communication oriented. And these textbooks are essential for developing both language proficiency and professional skills. On a language level, English Grammar in Use covers all the basic grammatical structures needed by doctors. In addition to traditional textbooks, digital tools play an important role in learning English for specific purposes in medicine. Some effective digital tools include Osmosis, an educational platform for healthcare students, apps like Quizlet and Memrise for vocabulary building, medical English podcasts and talks to improve listening comprehension and general comprehension skills, actually. These resources allow learners to practice and reinforce their medical English skills in real-world contexts, and they also promote autonomous learning. While digital tools enhance learning, assessments are essential for measuring progress and ensuring mastery. Let's now explore how assessments can reinforce medical English. Medical English learners should be assessed first on the level of language. So here we can use vocabulary quizzes, grammar correction, pronunciation check. But as we have seen, medical English does not stop at the level of language. So students need to be assessed on content, accuracy of terminology, clinical reasoning, report writing skills, and also they need to be assessed on communication skills, fluency and clarity, appropriateness in doctor-patient interaction. To conclude, medical English is an essential tool for communication in healthcare. It enables healthcare professionals to convey complex information accurately and effectively. Its unique features, such as technical vocabulary, impersonal tone, formality, empathetic language, make it essential for medical professionals to master. By focusing on specialized textbooks, digital resources, and practical activities, we can better equip medical students with the language skills they need for success in their careers. This research emphasizes the importance of specialized English in medicine and its role in improving communication, patient care, and academic achievement. It serves as background for us, for the group, to analyze and understand the needs of doctors and doctors-to-be, which will be covered in the second part of our Capstone project. Thank you very much for listening. See you in this second part of the Capstone project.